Onc Live Insights is a video editorial program produced by Onc Live.
Brentuximab, which is the antibody-drug conjugate, was the only FDA-approved therapies to treat relapsed refractory Hodgkin lymphoma in the last 20 or so years. Besides brentuximab, there are other agents that have shown some activity, however, none as promising. There's 4 different general classes we didn't talk about. One is the HDAC inhibitor, one is the mTOR inhibitor, another one is JAK inhibitor, and the last one is IMiDs, or immune modulating drugs. So talking about the first kind, the HDAC inhibitor. So these are penobinostat, moxinotat, vorinostat. These are, they don't target a specific pathway or specific, like CD30 or one specific kinase, but what they do is HDAC inhibitors inhibits acetylation, okay, of the chromosome. So thereby they cause a group of genes to not be transcribed, and has shown some activity in other kind of lymphomas. However, in Hodgkin lymphoma, a single agent, these drugs don't have an overwhelming positive activity. The response rates are fairly low. We're talking about 20 to 30%. Okay, they have low toxicity though, so that's why there've been a lot of studies trying to combine them with other things, like with chemotherapy or with brentuximab vedotin, to see if it can improve the response rate of HDACs. Okay. Now, in terms of mTOR inhibitors, such as everolimus, sirolimus, again, they target the mTOR pathway, and it has shown to be of some interest and has some activity in other type of lymphomas. In Hodgkin lymphoma, there are small studies done by the Mayo Clinic, and that shows about a response rate of some 40-some%. But again, it's a very small study, and in my own experience, I haven't seen too much activity level of these drugs. Okay. In terms of a JAK inhibitor, there was one drug. We know that Hodgkin lymphoma cells have the JAK kinase pathway active as well in the cells. However, there's been no drug that has been tested to show that has a good response rate. And the one of the kind of more exciting JAK kinase inhibitors recently actually kind of was withdrawn by FDA due to toxic side effects as well. So I don't think we're going to hear too much about this drug in Hodgkin lymphoma for now. In terms of IMiDs, or immune regulating drugs, such as Revlimid or lenalidomide, WashU, the Washington University group, did a study using this drug in relapsed refractory Hodgkin lymphoma patients. The activity was about 27%. Again, not overwhelmingly positive, but certainly you can try in someone that has no other options.
There are a lot of interesting and promising new therapies for Hodgkin lymphoma in development at the moment, and a number of those have actually, there's been data presented at the ASH meeting this year. Probably the one that's creating the most excitement right now is agents which are targeting the PD-1 pathway, the programmed death 1 pathway, and there are 2 studies presented at the meeting this year with 2 different agents that target that pathway, both monoclonal antibodies, showing overall response rates, one of them showing an overall response rate of 80+% in heavily pretreated patients, and the other one showing a response rate of just over 50%, again in very heavily pretreated patients. So these are quite remarkable results in the treatment of these patients, many of whom have had at least 1 and some 2 transplants already. So PD-1 as a target is generating a lot of excitement in the solid tumor world at the moment, and now in the Hodgkin lymphoma world as well. It's a very, very exciting target and some very, very interesting drugs.